A study published in 2020 deserves attention because there hasn't been more attention on it. Good old berberine. So berberine, I'm seeing, has this increased interest in applications for cancer, insulin resistance. When I was actually going to school, berberine only had really one reputation, and that was to fight potential infections. So it was commonly used like for urinary tract infections and other things. So the whole potential cancer insulin application is was definitely not around when I was in school. So, anyways, there was a really interesting study published in China, randomized, multi-center trial. It was actually published in the Lancet, so pretty well-known medical journal. And these are patients that say were prone to getting adenomas or colorectal polyps, and so they just randomized them into giving berberine 300 milligrams twice daily, and just see what happens when you're doing follow-up colonoscopies. And what they noticed is that it actually decreased the risk of getting polyps. And so and what's unfortunate is that this study hasn't been repeated again. So here it's published in a nice journal. It was multi-center randomized trial and showing some reductions in risk in colorectal polyps, and here we are in 2025 and haven't heard anything more about it. So, and the only side effect that they commented that was of note is constipation. So maybe the risk of constipation went up a bit. And but again, these are things that you customize to every individual case. So remember good old berberine for those who are worried about colorectal polyps and recurrence of polyps. It could be a really simple, easy thing that could help decrease your risk.